I'm Dr. Michael Swor. I'm here at HCA Doctors Hospital in Sarasota, Florida. I'm a gynecologist and GYN surgeon, and I'm here to talk to you about some of the things that we do as far as specialty procedures for women's health. Well, one of the first things is we do advanced laparoscopic surgery. And advanced laparoscopic surgery is where we use minimally invasive techniques, basically small incisions, short stays in the hospital or outpatient center, to treat any of a variety of conditions which are common in women's health. Right behind me here is an example of one of the new technologies that we've had for the last few years, the Da Vinci robotic technology. And we use the robot to assist in certain kinds of surgical procedures. The robot helps perform those surgeries in a more efficient, higher tech manner, which we think is better for patients. We don't use the robot in all surgeries, but specific surgeries where it has a good application, it tends to be a good result for patients, and shorter stay, faster healing, and we think better outcomes. Some of the surgeries that we use advanced laparoscopic surgery for are hysterectomies, removal of pelvic tumors and cysts, myomectomy, which is removal of fibroids from the uterus, removal of cysts from the ovaries, treatment of endometriosis, pelvic pain, treatment of pelvic support problems. We do pelvic floor repair as well. Those surgeries are most commonly done from the vaginal aspect. So they're vaginal surgeries. Doing surgery vaginally when possible also helps minimize the healing time, reduce the risks, and improve the outcomes for patients. So some of the problems that we treat with pelvic floor repair, vaginal repair, are problems where there's support difficulties, like the bladder dropping, the uterus dropping, almost like hernias in the pelvic floor. And another big area in the same kind of arena is bladder problems, bladder leakage problems specifically. And a lot of times those problems come kind of as a combined problem, and we treat them in a combined fashion. And that kind of leads me to one of the big areas that we treat in our urogynecology practice is difficulties related to bladder function. Some of the common problems are bladder urgency, where you have to go too often. Some of the common problems that we treat that are bladder difficulties, bladder dysfunction, are urgency, where when you have to get there quick. We call that the key in the door bladder. Get the key in the door, you got to get there immediately. Bladder frequency, where you just have to go too often, much more often than is normal, more than 10 times a day. Some women it's 30, 40 times a day. Problems where you have to get up at night, that's called nocturia. Problems where you have leakage of the bladder. And there's two kinds of leakage, two major kinds of leakage. The kind where there's an anatomic problem with the bladder needs to be stitched up or supported, and that's called stress incontinence. And problems where the bladder's almost irritable, and that's called urge incontinence. And surgery is the way that we most commonly treat stress incontinence. And those are actually very simple outpatient procedures done where there's a short recovery. It's sometimes a 20-minute procedure with excellent outcomes. Urge problems, frequency problems, urge incontinence. We're proud to say we've got some brand new technology in those areas too. And basically the treatment is either therapy or medication. And the medications are widely available. You can pretty much get that almost from your family doctor or local urologist. but the therapies are unique and not available everywhere. We have one therapy that's called ESTEM. It stands for electronic pelvic floor therapy. And basically, little electrodes are used to stimulate the pelvic muscles, to strengthen the pelvic floor and help with bladder function. The other technology is called urgent PC, and it basically uses stimulation of the tibial nerve, a little nerve that runs down your leg to your heel, and we use a little, almost like a little acupuncture needle. It's placed in your heel painlessly, and then little electronic signals are sent through the tibial nerve up to the sacral plexus, which is the batch of nerves that runs your bladder, and it desensitizes the bladder nerves and tells the bladder not to work so hard or so often or so urgently. And that's been very effective and has allowed a lot of our patients to stop any medications related to bladder function or bladder dysfunction. I wanted to talk a little bit more about pelvic floor problems. And this is often a very personal matter, which probably not a lot of people outside of the GYN office, hear much about typically, but very common problems, because problems in the pelvic floor can cause significant trouble for women. And it's a very common set of problems. And it's not just older women, it's women of all ages. I've had women that have had uterine prolapse where the uterus drops, or cystocele where the bladder drops, or rectocele where the rectum has poor support, that range in age from their early 20s to into their 90s. And sometimes the problems are really significant. For instance, there can be a lot of pelvic pressure, heavy feeling, discomfort. It can interfere with the normal function of the bladder. It can interfere with the normal function of the digestive system and passing the stools. And it can certainly interfere with sexual function. And since we know that many people are extremely interested in having a healthy sex life, all ages, we want to make sure that if that's an issue, we want women to have help to improve that aspect of their lives. When we do pelvic support workup, we'll see a patient. We'll, of course, do a normal history and physical and collect any other important information about her health history. I'll do a very detailed, careful exam, and we basically look at 7 different areas in the pelvic floor which can be, for lack of a better word, weak. The neck of the bladder can be weak, and that's what I was talking about before, which can give you incontinence, loss of urine when you cough or sneeze or laugh. The base of the bladder can be weak. That's called cystocele, and that makes it difficult to empty the bladder completely. The uterus, or if you've had hysterectomy, the end of the vaginal area can be weak, and you can see bulging or something protruding from the vaginal area. The rectum can be poorly supported. I call that the floor of the vagina can be weak, and it's sometimes difficult to pass stools and difficult to go to the bathroom. And this is kind of a personal area, but the vaginal opening can be weak and need support. And sometimes that can affect sexual function or be uncomfortable in lots of ways, and we can do repair work in that area. So all this stuff is looked at, evaluated, and then a careful treatment plan is put together for each patient, individualized to her specifically. We also will do what's called urodynamic testing. We do that in the office, so it's very personal, private, done right in our own little clinic. That's where we basically test the bladder, put the bladder through a bunch of different tests to see exactly how it functions, where the problems are. We fill the bladder, check pressures and volumes, and there's little electrodes, and all that information is organized in a computer report and helps me determine what the best treatment plan is for each patient. Another thing that we do as part of the workup for actually many of the problems that patients come to us for is what we call a physician-guided transvaginal ultrasound. And after the initial history, physical, careful pelvic exam, the patient will be set up where I personally do the ultrasound. I have extensive training in ultrasound imaging and interpretation, and we'll look at the pelvic organs and look at the areas where there's problems, and clinically, real time, right there, kind of see all the processes that are going on in the pelvic area, and it really helps put together a specific plan for each patient. And one thing I know we've talked about where we are and the technologies that we have and a lot of the different types of problems and procedures that we have to offer for patients. What I would like to do is encourage you, all women out there, to be open, talk to your physician, talk to your healthcare provider. Don't be shy about personal issues. Discuss sexual matters, bladder function matters, difficulties with bowel function. Trust me, the doctor, the nurses, they deal with this all the time. It's the normal thing for them, and they're anxious to help you and help you find solutions to any problems you have. So if I have one major thing to say to you, talk to them, talk to your doctor, mention things that are not going well for you or that you're having issues with, and you'll be surprised how open they are about it, how helpful they can be, help you find the right kind of support and guidance and hopefully successful treatment.